cleaning a wound with a drain and applying a dry, sterile dressing. So the first thing you want to do is check your order to make sure that you're able to do this procedure on your patient. Then you want to gather your equipment. You're going to get a sterile drape, sterile gloves, dressings, 4x4s, sterile saline, tape, and then lucky for us, we have this dressing change tray, which has all of that, plus scissors, plus medical ruler, plus your label that you would label your dressing. Okay? Then you're going to go ahead and grab some clean gloves, and then the sterile gloves is in your dressing kit. Okay? So then you want to, after you verified your order, got your equipment, you want to provide privacy as you enter the room, identify yourself to the patient, go ahead and verify that the patient is, identify the patient with the armband. If they can talk, great. You could just verify to make sure that the armband matches what they're telling you, so to be name and date of birth. And go ahead and explain the procedure. Let the patient know what you're going to be doing. And then you have your privacy. You've asked the patient about pain. Is there any pain? If there is, you administer something that is ordered by your physician. Then you would want to wait about 30 minutes, reassess his pain, and then go ahead and begin. Sometimes you might want to wait an hour after medication administration for pain, just to make sure that the patient's comfortable while you're going to be doing his dressing change. And then you've identified the pain, the patient, you got your equipment, and then you want to make sure that you get your bed, adjust the patient to working height. So I'm short, so I would put up fairly close to waistline, and that's usually where everybody actually should. Go ahead and get him comfortable. Providing safety. Once you put this side rail down, you never want to leave that patient's side. You never turn your back just in case the patient has rolls off or hurts themselves, something like that. Okay? Then you want to go ahead and expose the patient. Well, of course, when I entered the room, I washed my hands. So I'm going to go ahead, exposing them, making sure that it's appropriate, that you have him covered. You can also use a bath blanket, but this patient is actually fairly warm, so we don't want to load him up with blankets and all that kind of stuff. So I'm going to go ahead and perform hand hygiene again, which I did when I entered the room. This is going to be before I put on my clean gloves to remove the soiled dressing. So I'm going to go ahead and apply my clean gloves. Clean gloves, clean gloves. Then I'm going to go ahead and make sure my gloves are appropriate. Go ahead and get the tape off, because it really should be on only two sides. Now, when I remove the dressing, I want to look what's called P-coat. The presence of any drainage, the color of the drainage, the odor. You don't have to stick your head in there or anything. You just want to go ahead and see if there's an odor with the dressing. Also, you want to check for amount and the type of drainage. So go ahead and remove all this, being careful not to disrupt the drain. Then you go ahead and look and see the actual wound itself. Throwing your dressing, soiled dressing, away in your gloves right into the garbage can that you provided, so you don't leave the patient's side. Then you want to go ahead, grab your dressing kit, and then go ahead and begin. So we went ahead and discarded. We perform hand hygiene again. We are inspecting the wound for SAD-P. So that would be size, appearance, drainage, and if there's any pain. You also want to be checking the suture line along with the area around the dressing. You want to be looking to make sure that the wound is well approximated, which most definitely is. There is sutures in this particular wound. You would also assess for dressing, staples, and steri strips. That is a Penrose drain, so you would observe what type of drain and the area around it. You could see that it's a little bit pink, but there's no pussy drainage, and you can see that it's a little bit red in there, and that's because it's the abdomen itself. Okay? Then you want to go ahead and open your dressing tray with When you're opening make sure you're not touching inside because you are sterile. Lucky for us, the gloves are ready. I'll move my pen over here. Go ahead and open. My sterile gloves, grabbing inside, not allowing, go ahead and scoop these up, not touching my skin. I am sterile, so I'm going to touch the outside with my sterile hands, not touching my skin, getting my gloves on and nice and a comfy fit. Voila! Now I'm going to go ahead and discard this into my garbage can, which I'm not leaving my patient's side. I'm going to bring the garbage around this way so I can just go ahead and drop. Then I have my sterile dressing, or my chucks actually. I'm going to open and place on top, just like that. Now this is my sterile field. I'm going to go ahead and drop my gauze. This would be if I had, I could use for my cleaning. This is my sterile saline. Go ahead and open, pour directly in. Drop, drop, not leaving your patient. Put my my tape there. A garbage can, I'm just gonna put on my side. Most definitely I will need that. Here are my scissors in case I need to measure their wound, and then my abdominal dressing. This is what I'm going to choose to use since we don't have any packing. I'm going to go ahead and use this for cleaning purposes. So I'm going to go ahead and get some pieces for cleaning, cutting them, not cutting my glove, because if you do then you're not sterile anymore. We don't want to do that. Go ahead and cut. There's that. Then if I have some 4x4s I could also use for cleaning. You don't necessarily have to use this. I just don't want to run out of 4x4s. And then what you're going to do is go ahead and start from cleaning from the top of the wound to the bottom. So what I'm going to go ahead and do then is bring my garbage can back to drop, and by touching my feet because my hands are sterile, never leaving your patient's side. So I'm going to go ahead and get that nice, and I don't want it dripping with water, so I'm going to go ahead and wring it out. I want to touch my patient only, going from the top of the wound to the bottom, one nice sweep and drop, and do that a couple of times. And from that down there, drop. Then you also want to clean around the Penrose drain, and of course you would need more if it was draining. You're going to go from around the top of the wound in a circular motion, lifting, going around, discarding. Again, gonna go around, watch the Penrose drain, go around that way in a circular motion. Allow time to dry if you don't, because you would never want to wave it dry or blow on it. Then you would pat it dry and discard. And then we're dry now. So then if you had any ointments that the order was, then this would be the time, since it's clean, you would put your bacitracin or whatever ointment was ordered. And then now it's time to cover their wound. So you would apply your dry layer of dressing. Since this is a fairly small dressing covering it, I would take a 4x4 and cover like so. Then you need a drain dressing. Since there's not one provided, what we can do then is go ahead and do a halfway slit, like so. And then we can go ahead and lift the Penrose drains again, putting that around. And actually what I would do is kind of lift that one up again, place that there so the Penrose drain is covered. A lot of times you might need a couple more depending on how much drainage there is on your patient. Then it's covered, so then you would go ahead and take your abdominal. Always remember the blue line is blue to sky. You would go ahead and place on your patient like so. Then you would want to secure with tape. This is the time, since the wound is covered, you can go ahead and discard your gloves into the garbage and then get your tape ready. Please remember that you never do all four sides of your dressing, because that allows air to get in. So what you do is kind of eyeball it here. Always start with the tape from the in to the out. The reason that we have you discard your gloves here is the wound's covered, for one. For two, tape is really hard to handle with gloves on. You want to go ahead and make sure you go from out to in with your, and then this way the sides are allowing for air to get in. Then you want to take your label and you want to, the date, which is, using a black pen, the time, which remember it's in military time, and then my initials. You would go ahead then and remove and then just put right on top of the dressing itself. So that way when the next nurse comes in to assess, they see when and what time the dressing was changed and how often, depending on the order, the dressing does need to get changed. Then you would go ahead and perform high-end hygiene, checking the dressing every shift to see if there is any drainage. Maybe it has become disattached and you need to go ahead and reinforce. Again, remembering never to window pane it off. You only want to do one or the other, the two sides or this side, whichever is appropriate. You kind of go with the taping the way that the body moves. So that's why I chose to do this one, because if you do this one, then it kind of bends and causes the patient problems. Then it's time for documentation. So what you would do then is go ahead and clean up your mess. The scissors will go into the sharps container. You want to make sure you're cleaning up. You would discard all of this. And then you would make sure, discarding this, never leaving your patient's side. Get the bedside table out of the way. Make sure your patient is comfy. Ask them how their pain level is, because if you did not pre-medicate, you might have to medicate post-dressing change. So what you would do then is provide safety. You would lower the bed to the lowest position. So what you would document once we get to that point would be bed lowered and locked. You want to go ahead and place the call-out within reach. Bed lowered and locked, side rails up ×2, and then you would move to the nurse's station. So then we're going to go ahead and move to the nurse station, having the patient already bed lowered and locked. What you would document is the following things. You would chart the date and the time that you changed the dressing. If you saw any presence of drainage, the color of the drainage, the odor of the drainage, the amount, and the type. Also, which that would be your P coat. Then you would also describe the size of the wound, the appearance of the wound, and if there was any drainage again. And then along with any sutures, how many, staples, how many, steri strips, and then the drain, we would document on this particular wound that it is a Penrose drain. And then if any other kind, could be JP or Jackson Pratt, whichever way you want to call it, and a hemovac. Also, if there is any other type of drain that possibly can, make sure you assess the patient's pain and document it accordingly. And then if the presence of and how the patient tolerated the pain. Ending statement, patient bed lowered and locked, call it within reach, and side rails up by 2 or ×2. All right, that would be the end of our dry sterile dressing change.